Good evening, friends. Thank you very much for joining this wonderful webinar series of CAHO-ISQua. You are joining the 33rd series, and it's going to be a great topic for us today. And on behalf of CAHO, I wish to thank all the teachers. Today is a very important day. It's the Teachers' Day in India. And we wish to thank all the teachers for imparting knowledge, wisdom to all of us. Thank you very much. And with that note of appreciation to all our teachers, let me introduce to all of you the moderator for today's session, Professor Satish Chandra. Professor Satish Chandra is a very passionate teacher engaged in clinical trials, research, and medical residency teaching at the College of Medicine, UAE University. He is also a senior specialist at Tawam Hospital, Johns Hopkins Medicine. Following his PG in medical biochemistry from India, he obtained his PhD in tumor pathology and MBA in health information systems from the US. He is American board certified in medical quality, medical ethics, informatics, and innovation. He has published over 180 papers, including The Lancet and BMJ. He serves as Associate Editor-in-Chief of International Journal of General Medicine, Risk Management, and Healthcare Policies. He is also the chair of the CAHO Research Committee. And without taking much time, I hand over the session to Dr. Satish Chandra and welcome all the participants to this very important session today. Over to you, Dr. Satish Chandra.
Thank you, Dr. Lallu, for the kind introduction. It's really been a great pleasure to be moderating this session. So first of all, let me welcome all the participants from all over the world for this webinar. And not surprising, but we have two eminent speakers this evening, Professor David Greenfield and Dr. CAHO-ISQua. Let me take you through a little bit about their work and their passion and their fascinations over the years. Professor David Greenfield is a professor of health leadership and management, School of Population Health, Faculty of Medicine, University of New South Wales in Sydney, with over 35 years of experience and having worked in metropolitan, regional, and remote settings. His life has been dedicated in improving safety, quality, and efficiency of organizations by educating and mentoring professionals to lead, manage, and innovate. His focus is on systems improvement, health services translation work, and work and change implementation sciences. He is appointed to the ISQua Academy, ISQua Fellow, and as a Fellow of the Australian Association for Quality in Healthcare. He is also the Deputy Editor for the International Journal for Quality in Healthcare. Incidentally, I have already, before I could meet him this evening over this webinar, I also had a chance to read two of his publications prior to that a couple of years ago, which includes, I think I remotely include, if I remember correctly, it's about bringing people with chronic diseases into the community program, and also changing practices in healthcare, if I remember correctly. These are the changing practices in healthcare organizations. These are two publications I remember sometime in the past. Equally important, we have another speaker, Dr. CAHO-ISQua, a senior lecturer with the School of Population Health, Faculty of Medicine, New South Wales, with over 18 years experience of research and teaching, and experience in the knowledge translation, organization development, change and culture, experience in theory practice gap, and to improve organizations and management of healthcare systems. Academic rigor and industry outcomes being the cornerstone. Dr. CAHO-ISQua has supervised over 340 master's translation projects and directly supervised 160 of them. And these include change management, organizational behavior, operations management, healthcare improvement, and leadership. She is also the associate editor for the BMJ Open Quality since 2019. So I have two distinguished speakers with us this evening, and the topic that they will be enlightening us is QI improvement versus research. For a little bit of understanding about QI improvement, I think conventionally most people in the world believe QI improvement relates to components in a healthcare system And nobody, very few people think of QA improvement as a systems-based approach to improve both quality and safety of the delivery of care. And the research, on the other hand, is a systematic investigation or observation and to study the system's functions using tools and measurements to develop facts and new conclusions using a preset protocol. So these are the fundamental differences between the two systems, although both take a systems approach. With no further delay, thank you to CAHO, and it's my honor to invite Professor Greenfield to share his wisdom on QI and research. Thank you very much. Professor Greenfield.
Good evening to you all, and thank you very much. It's a pleasure and an honour to be speaking with you today and have this discussion around quality improvement and research with you, and also with my colleague Kathy there as well. I'm not certain about how you do things. Do you want me to share my screen and show you the slides that we've presented, or have you got those slides to view yourselves? How do you want to do this practically? Fantastic. Okay, thank you very much. Let me move through this then with you. As introduced, Kathy and I work at the School of Population Health at the University of New South Wales in Sydney, Australia. We both teach and research into the Master of Health Leadership and Management program that we run, as well as PhD students and research work with, generally with health professionals in some of the local health districts here in Sydney, but also with people around the country. So the four questions, I guess, that we thought really to shape the discussion with you this evening, I should say, are these. In thinking about quality improvement or thinking about research and which of the two directions you're going to go down, the first thing is really saying, what is the problem that you're trying to address? So before you decide what method you're going to use, how you're going to approach the task you have at hand, it's saying, what are you trying to achieve? And really, it's about knowing the destination that you want to get to so that you head in the right direction to achieve that destination. In doing that, it's really thinking about what's the evidence you're trying to gather to answer the questions or address the problems that you're confronting or that you're challenged with. With that, it then leads into thinking about what are the skills and resources available in undertaking the change or undertaking the assessment or the improvement project or research project. Who's in the team? Who are you bringing together to do this work? And skills and resources includes thinking about the time frame that you're also working within. You've got to be very clear about these four questions so that you're able to set out on the right path. If you, for example, with the three pictures on the bottom, if you're aiming for either or any of those different destinations there, and you're aiming to climb the mountain and you end up at the beach, you're ill prepared for what you're doing. So whether it's quality improvement or whether it's research, it's understanding these issues really fundamentally so that you know what you're trying to do, what the information is that you need to collect to answer that question or to inform you about what you're doing. Have you got the right resources, the skills available to do that? Are you working within the correct time frame? Are you trying to do something too quick, or is it a much longer time frame? How small or big can the project be to achieve what your goals are about? Getting these questions right at the start is really fundamental to a successful project, whether you're talking about quality improvement or whether you're talking about research. When we think about quality improvement or research or both things, it's really thinking about, I think this is a good diagram that makes us think about what are we using or aiming to seek that information for? What is it that we're trying to improve? What is it we're trying to understand? What is it that we're trying to assess to get better insight into or improve the service that we're looking at, or improve the system or the process or the clinical outcomes, the staff outcomes, the organisational outcomes? So it's really stopping it, and as a team at that very early stage, it's thinking about what it is that the goal is about, how we're going to go about undertaking that project so we know and there's agreement in the team about where you're going with that. And as this diagram shows, this is very much about thinking about it as a learning cycle. So it's about seeing all the components integrated together. And so one of the things we try to do is to stop and think about, if we've undertaken whatever project we're seeking to achieve, imagine us at the end of that project, in whether it's 2 months, 2 years, and we've completed it. What is the information we're likely to have? What stakeholders do we need to engage and talk to about implement changes or to drive changes or new directions for services or systems improvement? So by thinking about the end result and that translational aspect, which Kathy will no doubt talk about shortly, it's thinking about where you're going to with doing that. And for us, it's understanding that all these pieces are fundamentally linked in together. And so it's not thinking about them separately or further down the track. It's understanding all the pieces and thinking about them in a very much a systematic way and an integrated way continually. The paper, you can see that on the side, the paper that I'm drawing from, which was a chapter from the book, and you can see the reference down the bottom there. And they, I think, break it up quite nicely in terms of being able to offer the types of research that you're aiming to do, the evidence, the purpose of what you're aiming to achieve, and then the type of decisions that you're aiming to undertake as part of that. And by having a framework like this, I think it helps you have a common language to share amongst the team to ensure that your goals and your goal is shared, and you may have multiple goals, but those goals are shared by the whole team. So everybody is in agreement about what you're aiming to do. All of these things are important and vital, but it's about ensuring by having everybody understand the goals that you're not going to have any conflict amongst that team or different expectations about what you're trying to improve or the changes or the impact that you're trying to have through that. Now, on this work that I'm presenting here, I've put in on the bottom quality improvement. They don't include it at that part because they're talking generally about the research. The idea is from a research perspective. But I think quality improvement fits quite nicely as part of that set of points there as well. And the last line you can see there about context-specific evidence on processes or outcomes of the health system, policy interventions. I think that's also a description which can apply as much to evaluation research as it can to quality improvement research. So again, it's about whatever you're going to do and how you're going to do it, have a framework that you as a team can use and can bring you together so that you're all on the same page, you're all got the same understanding about where you're headed towards and agreement about that so that you have that right from the outset. This is a paper that Kathy and I, with some of our colleagues, put together a little while back, talking about health systems improvement. And what we did with this is the conceptualization that we put together for this, where we put these three things on a spectrum together so that there's quality improvement, there's research, and then there's what we call translational research, which I'll let Kathy, as I said, talk about shortly. And it's about understanding that these three things fit nicely together, that there's an overlap between the three type of items. And as I'm saying, it's really understanding the outcome, the resources, the time, and the capacity about what you're aiming to do when you're undertaking any program. The difference, the way we use this and explain this with students and health professionals that we work with is about this sort of definitions or points that we're making here. Generally, quality improvement is about applied practices. Generally, ethics is not required. It's lessons about practice changes, the short time frame, and it's also a very particular focus on a setting or population. The research tends to be much more evidence-based. Ethics is required. It's a key grounding in academic literature. It occurs over extended time period. Part of the point of doing the research, as much as understanding what's happening in one particular context, it's also about making a contribution to the evidence base, and the outcomes are generalizable to other populations. Now, to that, when we get to the translational end, we add the idea that the translational research is about promoting interprofessional collaboration, so that when we're undertaking that work with health organisations here in Sydney or here in Australia, what we're really doing is engaging with those organisations at a very early stage to talk about what the problem may be, what we're trying to, what they and us, we can improve together. What is it, the work that we're going to do together? So it's not us as researchers going into an organisation to do something to them or for them, but it's work that we're acting on collaboratively. Now, you may read different things that say quality improvement is less rigorous than research and that research is much more rigorous and systematic. I don't think that that's quite right. For me, it doesn't matter what you're undertaking, what project, whether it's quality improvement, research, translational research. I don't think it matters what the focus is, the goal is, all the techniques that you may or may not use in those different projects. It's about doing everything in a very rigorous, a very systematic, and a very competent way. So that there's no point in doing a quality improvement project where it's not done really effectively and in a very structured and standardised way. Otherwise, because the results then can become meaningless or inappropriate. So it's doing your work to a high standard regardless about what the task is that you're engaging in. From this paper, we've then set out here, you can see we've broken down and gone through the purpose, the design, the ethical review, the benefits, the outcomes, and the dissemination plan. So again, it gives a framework for you to think about what the task is that you're aiming to do and some of the key ideas or questions or points that you need to address, regardless of which of those three projects that you may be undertaking as part of that. And I offer that to you as something to have a look at. This is an example that we've put together in that paper to show we've picked 3 or 4 topics you can see down the left-hand side there, and we're able to show you that each of those topics, for example, the top one about communication practices, how that could be done as a quality improvement project, how it could be done as how it's been done as a health research project, and then also as a translational research project. So that's where it doesn't matter what that topic is that you're aiming to address to start with, you can then go down different paths with that, adapting whichever of those particular activities you want to use to get to that end. And again, that's dictated by resources, time frame, expertise of the team and what you're trying to achieve through all of that. So that's something that you can consider. And again, this is a table from the paper that I give to you to have a think about. So again, you can see down the left-hand side, it's scoping out the different steps involved and then using that, thinking through the different aspects of that across. Now, where you can't quite see the top of the screen, but it then gives you the issues to look through. And I think the final right-hand column there is you can make notes about that. So as you work through those different steps, it helps you then think through about what you're doing, how you're going to do it, and what that type of project is about. So that's the sort of broader background in terms of thinking about how we think about quality improvement and research and seeing them as overlapping and connected on that spectrum. This is a resource I'd certainly recommend to you if you don't know the Health Foundation in the United Kingdom. They put out a whole range of policy and resources which are really quite excellent. This is a paper that they put out, I think it was in 2021, up there in the top corner, which gives a very good description or an explanation about quality improvement is, how to undertake it, and the aspects of it and why it's so important. This is taken from this paper again, this report that they've done, and I thought this was a really great little diagram about the figures, the habits of quality improvers. And perhaps it's something that you can have a look at together and as part of your teams and think about how you embody these characteristics or these habits. Are you doing these things? Are you undertaking questioning, problem finding, making connections? How are you accepting of change? How you approach these issues, how you develop these habits, and then how do you engage your colleagues to engage in this behaviour as well can help create a culture, help create that safety culture that you're aiming to do across your organisations, which engages a wide network of people in looking at improvement and looking at research work. This paper here that I wanted to present to you just very briefly, again, it gives some very clear and straightforward definitions of quality improvement and what it's aiming to do. And again, you can see the language in this about systematic change methods and strategies. It's about the focus about making a difference to patients by improving safety, quality, their experience of care. These are all the things I just heard that in your presentation, your opening song that you have there, which I think really captures the aim of much of this work and what it's about. So I think this is something that seems to reflect exactly the ideas and the goals that you as a society are talking about. As part of this paper, what I thought was really useful, jumped out of this, was this figure which shows how quality improvement is linked to research, clinical transformation, evaluation, and clinical audit. And it shows that all these different aspects, or tools or techniques, are interrelated and impact positively on each other and how they can be used together. So quality improvement sitting there in the middle, how it can be used by undertaking small projects can lead into higher or broader research projects, which can lead to publications and drive improvements and development of the knowledge base. And at the same time, work from research can feed back into quality improvement projects at a local area. And again, in the bottom corner about clinical transformation, there's a link between quality improvement and clinical transformation, and the two things can help achieve one another and help drive one another. And anything like this, I think, is a really, this sort of figure or diagram, any framework like this, I think is really useful. As I was saying earlier, it's something you can use to bring together a shared understanding and a discussion point for your teams to talk about how we think about things, what you're conceptualizing, what you're aiming on doing, so that you make very explicit and very transparent the goals, the expectations that you have together individually, and also that you share with your other stakeholders, so that you bring people along on that journey, whether it's a quality improvement journey or a research journey, that it builds that collaboration and that network with one another. This is a paper I would recommend to you. Some of you may know Selma through the ISQua network, and this is the book that it's from. And again, it's about driving improvement in different settings. And while it's termed about low and middle income countries, it's a paper we would use with students here in Australia as a well-developed country. And again, as you can see from the key messages there, it's about the focus on patients, team involvement, people being accountable, and finding and using the right data, collecting it in a very systematic and a rigorous approach, and then analysing it and applying it correctly and through and all of that. So I recommend this to you to help you think about what you're doing and how you're going about it. Again, they've been excellent in how they've outlined the different frameworks and the type of activities that you can use, from the plans to do study act at the top, as you walk down through different models that are there, and the description and the outcomes of what they're trying to achieve. So any work like this, I think, is great in being able to ensure that your expectations and understanding together is very shared, and you're on the same page in what you're aiming to head with all of that. This, I thought, was a very useful table in terms of a comparison between the PDSA cycles, the IHI model, Lean Sigma you can see there, and the CARE model as well. And they talk about what it's aiming to achieve and how you can use it. So this is a great simple device, again, to get that discussion going with your stakeholders and with the team that's going to be involved about what you're going to achieve and how you're hoping to achieve that. And have you got the right resources with the right people with the time to achieve what you're aiming to do. In saying all this, I really like this paragraph, or a couple of paragraphs about it, is that it's not going to guarantee error-free healthcare. people make mistakes. Systems sometimes have flaws or mistakes in them. Sometimes things go wrong. But the whole goal is about engaging in that reflective inquiry to say, what are we doing? How do we improve it? Is quality improvement the strategy we want to use to engage our stakeholders, to engage one another, to drive that improvement, or do we need it to do it through a research process? And also, when thinking about quality improvement programs, what the focus of those are. Are they local and more internal or internally focused, orientated, or broader quality improvement programs such as accreditation, as you as a group are engaged in, which is driving systematic change across an organisation and across the whole healthcare sector as well, is critically important. So it gives a way of starting to think about those differences, the different levels, and where your focus and attention is on with that. And again, as I keep saying, it provides a discussion point for people to think about what you're doing and how you're doing that. Again, this is just further work which breaks down that and gives models for thinking about how to approach it, from the clinical audit right through to the third one here about peer-to-peer assessment and the value and the purpose of what they're trying to achieve. So again, I recommend this sort of tool to you to help think about that initial stage, about what it is that you're trying to achieve and how you go about doing that, so that you've got that clarity about what your purpose of what you're doing is. Now, I'm sure you all know all these very simple things. You know, quality improvement is really underpinned by this very simple cycle, the PDSA cycle. If you don't know the IAHI, the Institute for Healthcare Improvement from the United States, I would certainly recommend this, their work to you and their website to you. They have this Quality Improvement Essentials Toolkit. If you haven't seen it or haven't shared it with your colleagues, it's a document that you can download, and it's got really simple resources that are highly applicable, easy to use, they're well explained. There's fact sheets or explanation sheets about their implementation and their use, and a whole range of, you can see here on the, I think that's the right-hand side for me, the list of type of items that they have. And so these are really give you a whole range of tools to be able to think about, if you're undertaking a quality improvement project, what is it you're aiming to try to achieve? What's the techniques? What's the data? What, in understanding the problem, what is it? How do you focus in on that in the appropriate way? One way can be using, you know, what's called the cause-effect diagram. Another way might be a flow chart if you're trying to understand the process and what's happening and how things are happening and how things need to be reorganised or improved to get better system flow of patients and care to patients. Or it could be about looking at how the service is functioning and where there are blockages and how that could be improved, such as a histogram. I'm looking at, in this example, time of turnarounds, etc. So the toolkit gives all these different sort of models that gives you different techniques for getting into doing quality improvement, to get the right data to answer the questions and to make those improvements that you're trying to achieve. And many of these techniques here that we are put in under quality improvement can also be used in research work. And that's where I think there is the overlap between things. The other example I've got in here is a run chart. And again, it's different ways of visualising, understanding, examining, visualising the problem that you're trying to address. And I think that's where having a look at the toolkit helps you then think about how to present that, how to examine that problem, and then how to present the information, the results from that quality improvement, that activity, back to your colleagues, back to the stakeholders, the services, to get people engaged to say, right, we understand what's going on. What do we do now to improve that? How do we implement the change? Just to think about things slightly differently for a minute or so is to then also say there is a couple of very good resources around. There's this one on the next slide I'll show you, which is about the curriculum for implementing quality improvement and patient safety. And this is a really great resource which you could adapt and use with your colleagues if you need to put in a broader program to help skill up people's knowledge base and their capacity to work in this area. And they've done some research, evaluation research about how they've gone about doing this. And again, this is worth a look. And this can be accessed online. And we've sent these papers through to you, which can be distributed in due course. And again, this is another curriculum that they've done. And you can see that the way they've broken it down in terms of all the different appendices that are available as part of this resource to help educate and train people so that you've got that spread of knowledge across your service, across your organisations, and you build that network of people that are orientated and engaged and have a common language, a common way of approaching quality improvement and improving care and improving patient outcomes. I might just pause there and let Kathy take over here and have a discussion with you about research and the aspects of that.
Great, thanks, David. And thank you all for the invitation to come and speak to you a bit about quality improvement and research. And I think what David has really nicely outlined at the start is that quality improvement and health research are really not all that different. And I think thinking about them as a continuum is really important. Where one starts or stops, the other one starts. And I think a lot of very good research and a lot of very good applied or translational research starts off by being quality improvement or inwardly focused and moves much more to an external sort of focus where other people can learn from some of these really wonderful initiatives. And I think that's really the biggest difference across the two. The other bit is that it's really thinking about some of the internal quality improvement projects that occur and the lessons that are happening at a local level, and really speaking to a much broader community who are interested, who might have similar sorts of issues, who might be coming across similar sorts of problems in their own health organisations. And rather than reinventing the wheel, being able to look at something that's been published, whether that's in a peer-reviewed sort of forum, in a webinar, however that's been disseminated. And research is really thinking about three components, and what in defining the problem and then thinking about reviewing the literature, it's really trying to focus on the project being something that confirms, contradicts, or extends previous knowledge, and really trying to do that from an evidence base that looks much more outwardly at what is happening. So then once you figure out really what the outcome is that you want to achieve and what the problem is by looking at what already exists out there, selecting an appropriate research design. As David said earlier, it's thinking about the timeline, the resources, the people that you can draw upon, and being really sort of realistic about the sort of research design and how much you can actually put into solving that particular problem, and scoping the research in a way that other people can learn from your outcomes, but that actually is achievable. It's then about formulating a hypothesis, or really in health management research, you may not be attempting to test, prove or disprove something, but really formulating questions like how, what and why. And so in starting off and thinking about the sorts of research questions from a health management perspective, this is really complementary from a quality improvement project, because you're usually asking those sorts of questions anyway. Why is something working? Why is it not working? How have we come to this point? What is happening? What do people think about a particular idea? Carrying out the research and then interpreting the results is really important. It then is about figuring out the implications of the data that's been collected and trying to find an answer to the original question rather than sort of deviating from that. So then the reporting of the research finding becomes really important as well, and thinking about the different stakeholders. Again, at the start of the session, David outlined in defining what your practice question might be, whether that's quality improvement or research, think about the stakeholders, those that might be impacted by the decision, and those, or really the implications of the research, and who it is that you need to communicate your research to. We'll speak to you a little bit about that and provide you with some resources later on. So the next slide, David. There's really a lot of evidence that's out there, and not all evidence is created equally. So in thinking about the original or the previous slide, which is defining what the research question is or the practice problem is that you're seeking to solve, and thinking about that literature, it can be really, really overwhelming, and starting off and knowing where it is that you, or what kind of evidence you need to select. So it's being realistic about that, and it's thinking about the type of outcome you want to achieve, but also, are you looking at things like observational studies, or are you looking much more at a critical appraisal? So a meta-analysis or a systematic review to help inform your study may not always be required. It may not actually help you to develop an evidence base for you to answer those three questions, which is confirming, contradicting, and extending the knowledge base. You may have to look at things like individual case reports. So if you think about it from a clinical perspective, they might be much more appropriate, especially if you're looking at safety and quality sorts of outcomes at a local level. Also, perhaps looking at background information, expert opinion, and other sorts of guidelines. Again, this is a really great resource that's there at the bottom of the pyramid for you to consider when you're trying to scope the problems, different types of literature that's available. There's also different types of research or publishing organisations. This is from a research and development perspective in Australia, but I think the lessons can be extrapolated at an international level. And so thinking about where it is that you can start to source some of this evidence, not just from a higher education perspective, so from universities, research groups and associations, which are really great, but sometimes you may not be able to get access to the peer-reviewed articles and the resources, and they may not be the most appropriate. It's thinking about government and public sectors and some of the reports that may be much more readily available. Also, some of the non-government organisations or civil society organisations, so the non-for-profits, publish some really wonderful work and really look at some of the other communities that may not be traditionally serviced. And also looking at the commercial or private sector. Again, it may not be able to easily accessible in terms of finding some of this evidence, but what we are seeing certainly is that some of the larger companies and news media are making their findings much more accessible and much easier for people to source. So again, thinking about the types of evidence and also the organisations or the places that you might source some of the more appropriate evidence in helping you formulate your problems. In terms of thinking about the components of what we call translational or applied research, we've published, or we have an article in press in the Journal of the Health Administration Education, and really it follows a simple process, again, from a quality improvement right the way through to a research perspective. It's always about starting off thinking about the focus and the research questions. So what is the knowledge translation you're seeking to achieve? What outcome is it that you're seeking to achieve? It's then about identifying the evidence, so building the base with the different resources or the different evidence that exists out there, and being really specific about the study context, so the setting, the location, the organisation. And the next couple of steps, so 3, 4, and 5, the study methods, which is addressing the study feasibility within the context, and also finding data collection tools that are rigorous, that are validated, or might be purpose designed. Again, being very realistic about what already exists. If it's out there, if you can modify it, if you can use it as it is, that's great. If you really feel that you need to develop something purpose-built, it's thinking about that extension from a timeline perspective to test that, to make sure that it works, to make sure that there is an evidence base behind it. And if you don't have the time, if you don't have the resources, it's really trying to see what already exists and making some of those decisions from a feasibility perspective. And it's also thinking about analysis. In terms of quality improvement and health management research, what we are seeing is that a mix of multiple methods, whether they're quantitative or qualitative, it's not one or the other. If you think about patient safety, some of the stories that we hear from a patient perspective are really important, as are some of the statistics about some of the critical incidences that occur. And so putting those two together will give you a much more complete picture. And finally, it's about that knowledge translation. So where you start is where you end, thinking about the outcomes and the implications. It's also thinking about health service research across the different levels and thinking about the interrelationships and the assessment focus. Quality improvement does tend to start at an individual or team level. And as you can see from this diagram, it works its way up through a service department level, an organisation network level, and then right the way through to a policy or a government or an international sort of level. Again, you can have some really wonderful quality improvement work that starts off at that individual level that can make its way up to a policy level, but it's being very realistic about the outcomes and the implications that you want to achieve and thinking about those right from the start. So it's targeting that to say, who is it that we want to tell our research about? Who is it that we want to communicate with? And it may be appropriate at an individual team level, and you might do that from a health management or a health research perspective. But it might be that you're really thinking about things at a policy level. You want to make a change and you want to design your research in that way to think about how you can make some sort of improvement or recommendations for implications to policy. In terms of some of the resources that do exist, SAGE Research Methods has some wonderful resources out there. They are open, open access. And again, there is a link at the bottom there that you can have a look at. But we really encourage you to have a look at some of these because they've got a range of different resources right the way from thinking about the basic key concepts in research. And if you've been used to clinical research and you're being asked to sort of look at more of that quality improvement or management type of research, similar words might be used, but they might mean something different. So really thinking about the research methods and really understanding some of those overlaps and what the differences are, right the way through to research ethics. Do you need to apply for research ethics? Even some quality improvement research may not have initially started off as research. The intent was to do something at an internal improvement sort of level, and the participants realised that there were some really great opportunities to tell other people at a sort of service department level right the way through to a policy level about the implications for practice. And so you don't necessarily always have to go through research ethics, but it's understanding the process, what's appropriate for you to report as well from a quality improvement versus a research perspective. So again, have a look at some of those resources. SAGE also has some really great research resources as well, but the really interesting bit that they do have as well is the Getting Published webinar series. When we undertake quality improvement or research, we often think about the presentation or the dissemination aspect at the end, but it's really important right at the start from that knowledge translation perspective and thinking about who it is that you want to use the findings from your research study to think about how you're going to disseminate that research. So have a look at SAGE. We do have a link at the bottom there as well. We also have some other resources, again, in thinking about improving knowledge translation to increase the engagement and impact in healthcare. Health is very good at undertaking excellent projects, but not always great at telling other people about their initiatives. I've just attended ISQua last week in Korea. It was fantastic. And listening to a lot of the projects that my colleagues in other countries, I couldn't help but think about the similarities across the different problems that were occurring from a developing country right the way through to a developed country perspective, and that richness of hearing what was happening at that level, but knowing that not all people will be able to get to an international conference, may not have the time, the resources, or the interest. So it's really thinking about what the most appropriate communication method is going to be in designing, disseminating, and implementing research. It's also thinking about the stakeholders that you need to do that with. So if it is a patient improvement sort of project, thinking about how you can communicate that research with the patients. If it is a conference, it's thinking about, can you bring the patient along or a patient representative? If they can't come along to it, can they actually help you to develop that particular presentation? We've developed a tool as well to think about that dissemination sort of strategy, and it's thinking about the information complexity. So how much information do you have? If it's low, a podcast might be more appropriate. If it's high, a peer-reviewed journal article or a research report might be more appropriate. It's then also thinking about the interaction with your stakeholders or participants. If it's passive, again, something like an infographic might be more appropriate. If it's active, it's thinking about that elevator pitch, that 30-second sort of pitch to someone to say, this is what the research project was about, this is what we intended to achieve, these were the outcomes, and this is how it can change practice. There's also in that article as well a checklist outlining the key criteria for research dissemination. Again, it's by no means sort of exhaustive or conclusive, but these are some really good questions to help you think about the dissemination channels and think about the different sorts of detail that you may need to provide in that dissemination strategy. In terms of research, from a systems perspective, the WHO has some really great topics and a really good starting sort of basis, and they're really broad, they're very generic, but they categorise them across these 5 different areas. And again, we've provided that link there for you to have a look at that. I think in looking at these different areas, again, these can be used from a research perspective or a quality improvement perspective, or both. The next bit as well that WHO have provided, which we really thought was a valuable tool, was they've come up with a 6-point agenda for action to facilitate the evidence-informed decision-making at an internal sort of level and thinking about the strengthening of health systems at a much broader level. So a lot of what can happen at a local level and thinking about how that has implications at a policy or a much broader level. So again, we do have the link there for you to have a look, and we encourage you to access that. And finally, this was a really good tool as well that we found in this article, and it's thinking about the methods and tools and the work related, as well as the resources and the services. Again, have a look at this here, because what you can do is you can think about it from a supporting access to evidence perspective, that capacity development for the evidence-informed decision-making, and then the systems change resources. And they've got a whole heap of those resources there that have been used very widely and then have also been updated. So again, a great list of resources for you to use. We've kept to time.
I'm sure there could be a few questions. So first we'll address those questions. And then I do have a couple of questions, which I will possibly share with you towards the as soon as we have taken 3 or 4 questions from the audience. So from the organizers, can I have the questions, please? So there is a question from
Yeah.
Luciana. It says, how could we connect research and quality? I'm not sure what that means, but basically, I think you started off by saying that quality improvement and research happens to be a continuum. So there is, I don't think there are any internodes where you could connect since it's a continuum. Any thoughts? You want to say something about it? Dr. Kathy? Can you hear me?
Oh, I can. Sorry, I think David was just going to jump in there.
No,
Okay,
wait,
please, yeah. Either of you, it doesn't matter though. Sorry.
David?
Just to reinforce what we said, that for us, it's about understanding these things on a continuum. It's thinking about what you're trying to achieve, where you're trying to aim to get with that. I think the critical part of that question I saw was, how do you engage this as the daily routine for frontline workers? I think the answer to that part of the question really is about saying you build those people as part of the team so that they're part of the conceptualizing, the thinking process about what you're trying to achieve, so that they then see the purpose of it and are then motivated to find that time, find those moments in their day to actually undertake the data collection and analysis, etc., so that they're part of doing whatever, whether it's quality improvement or research activity. They're not something that it's happening to. It's that collaborative effort, building networks all the time.
And
Thank you.
So if I can add to that, I think it's giving them examples. So if there have been quality improvement or research projects that have been undertaken and driven at that practice level, it's showing them off, whether that's in the same way that we show off clinical-based research in hospitals and health centres and things. It's actually saying to others, look, this research has been published. Our clinicians or our managers have gone and presented at this particular international conference. It was really positively received, and starting to showcase that sort of at an internal level to show others what you mean by quality improvement or research.
Thank you. And the other question I saw on the screen that I witnessed on the screen was, how do you conduct an effective gap analysis? That was the other question from one of the audience.
So I think it's also thinking about if you go back to the levels of evidence. So what we're starting and what we did see during the COVID sort of pandemic was that where we couldn't undertake really systematic literature reviews or meta-analysis, there's things like rapid reviews or scoping reviews, which help you to really understand what the particular issue is that might exist, to think about the evidence that's out there, and to really start to pitch or to really pinpoint where your research might actually see to figure out what's happening at a broader sort of level.
Thank you. And a subsequent question was from Dr. Hemlata. She was asking, what is the role of iterative learning in quality improvement?
Look, I think it's a really important role in that it's about sometimes going around the PDS cycle or your evaluation process numerous times. So it's about understanding that you undertake a task, generate some information about it, get the team to look at what it's about, what it's saying, how do you improve, whether that's about patient flow, whether it's about time frames, whether it's about improving communication. It really doesn't matter. But the idea of iterative learning is repeating the activity numerous times and continually learning from it. And part of that learning, I think, Dr. Hanna, is also really that comes from different people in that process. So that sometimes it's the learning that comes from people that are on the edge of the process that aren't caught up in it and everything that's happening in it, but might be observing it, who can be really insightful and say, well, this is where I think things are getting stuck. And because they're not part of it, but can see it, are close enough to see it, they can be really important to learn from and to listen to. So it's ensuring that whoever's involved in that healthcare team, from the administration people to nurses to allied health to medical and senior medical people, that everybody has a voice in that process and gets to contribute to that learning, so that it's not just the senior people that are doing the talking or doing the work, but again, it's that broader stakeholder engagement of all people in the collaboration process.
Thank you, Professor. There's one more, I think, one audience question, and then I'll come back to my question. And the question was, the question actually was phrased a bit differently. It says, how many clinical audits should I be doing? Rather, I would rephrase the question and ask you, should we conduct a clinical audit when something is broken down? Or should this be a continuous, continuously, that it's our attempt to continuously monitor our practice and find gaps and then fix them?
I think the first point is really about questioning what you think the problem is, and not assuming that you know what the problem is. So when whatever you're looking at, whatever service, whatever improvement, whatever teamwork, whatever it is that you're trying to improve or trying to research, it's stopping and asking that fundamental question about, do we really understand the problem, or are we just assuming what we think we know? Because sometimes what we do is we apply learnings we have or knowledge we have, which we've taken from somewhere else, or we think we understand the problem, but we don't actually take that time to actually pull it apart. And that may, using audits, it may be the fishbone diagram, it may be collecting other data, doing that review, doing that evaluation, to understand what the problem is, to then think about, before you get into working out what to do about it. In saying that, the other point I would add, though, is sometimes you do have a problem, you know it's a problem, you need to make a change. You can't just sit around and forever explore it. So sometimes it's about doing something, that iterative process that we were just talking about. It's doing something, it's noting what the change is, it's looking at the consequences that come from that, both the positive and the unintended, and then making the next round of improvement on that, so that it is that engagement, continual engagement through that. It's adapting it to your problem to get the best fit for you. There's no right or wrong way. It's continuing to do it in a very positive way, and being very honest with yourself and with one another is key. You know, that honesty, that communication, that openness to deal with the issue is the critical thing, I think.
Thank you, Professor. I would like to pick your brains, both of your brains, for a collective wisdom, because what I have experienced through my years of working, research is sometimes sidelined with the criticism that it lacks pragmatism, because it's not real world experience, because the research is sometimes done in a very contrived environment. And when you think about quality improvement projects, it is too localized to make any meaningful conclusion. So how do we make this process of continuum quite pragmatic?
I think it's going back to making sure the right people are there at the start. So if it is a local problem, and surely you have discussions with people outside of your local network. So you know that somebody down the road in another hospital is facing a really similar issue, but why are you all facing the same sort of issue and you can't seem to come up with a solution? Or why do you have different solutions to it? And out of all those, you're sort of still having a discussion about, is my solution better? What's different about yours? I think it's having an awareness both at an internal and an external environment perspective, so that you're able to assess what's happening from an internal perspective, which is why accreditation, audits and things like that are really, really important, because it tells you what's happening at a local level, but you've got some comparative sort of frameworks or guidelines. And then looking at what's happening with other people. So if it is a problem that needs to be solved in multiple sorts of places, and thinking about, well, what is it that the literature tells us exists already or doesn't exist? And so you might collect some of these statistics and do some of this improvement at a local level, but it is keeping an eye on what's happening at an external sort of level as well. Doing some of that maybe rapid or scoping review to get a bit of an idea about what is out there, and then thinking about those sort of forums for you to communicate that more broadly.
Thank you. I think for the sake of time, I think I will pass on the I will hand over the floor to the organizers. Before that, let me thank you both sincerely. I think this was a great experience. I think both of you are an encyclopedia of knowledge. I was tremendously impressed and enjoyed this webinar from both of you. And we look forward to having continued interactions, and I'm sure there'll be more questions and engagements in the future. We look forward to it. And it has been very interesting session. Thank you very much. Thank you to Professor Greenfield and Dr. Kathy for an excellent presentation and information. I will now hand over the floor to the organizers for their closing formalities. Thank you very much.
Thank you very much, Professor David Greenfield and Dr. Kathy, for the wonderful session. A lot of doubts clarified, and I think we have a lot of things to do in the low and middle income setting. I think there are a number of quality improvement exercises being undertaken, but what is most important at this point is to publish them as well, make them available, and add on to the academia, because we have dearth of literature available from our countries and the setting. So thank you very much for your inputs and for sharing your knowledge with us. Thank you very much, Professor Satish Chandra, for moderating the session so well. As a mark of our appreciation to the speakers, may I invite Professor Satish Chandra to hand over the virtual certificate to both our speakers. I request the CAHO team to please put up the certificate. Thank you very much, and it's indeed an honor and a privilege to have the two of you with us today. Professor Satish?
How do I do that? I just
a word of appreciation and handing over.
Yeah, Professor Greenfield, I don't think I have sat through a QI versus research topic and enjoyed it so much. And I'm sure this has been the same response from our audience and the whole of the CAHO team. I don't think it could have been any better. So thank you very much. And this is a token of our appreciation.
Thank you. And to Dr. Kathy, your response, please, Professor David.
Oh, sorry. I just wanted to say thank you very much. It's a pleasure to do it for you. I hope it's useful. And good luck with your projects. If we can help you in any way, please reach out to us.
Thank you so much. Professor Satish, to Dr. Kathy.
Again, Dr. Kathy, I need not repeat what I said, because I think both of you are an encyclopedia as far as the QI is concerned. And I think I wish I had the opportunity to interact with you guys earlier. I would have learned a lot because in addition to what we do in our hospitals here, and more importantly, the toolkit and the presentations were also equally informative, because I don't think I've been exposed to these segments of the quality process previously. So I am really impressed, and as a mark of appreciation, a token of appreciation, I am happy to share this certificate with you.
Dr. Kathy, thank you so much for your time, and your response, please.
Oh, sorry, pressed the wrong thing. Thank you. It was really lovely. Thank you for the invitation, and really great to speak to you about this. I mean, David and I can speak to you about research and quality improvement all day. We really appreciated the interaction and the questions from the audience as well. So thank you.
Thank you so much. And we really look forward to working very closely with you. Do take some time and share your knowledge with us. We will be troubling you with more questions. And I'm sure our research committee, our student research mentoring committee, will take a lot of inputs from you as we progress in our journey of research, quality improvement projects, and also trying to publish them as much as we could. Thank you so much.